Hi, and welcome to BOMA International's Deeper Dive video presentation. I'm John Salustri, and the topic today is health and safety in the post-pandemic workspace. This, of course, is a companion piece to our online deep dive feature, which dealt with the post-pandemic workplace, and which you can access at boma.org/deep dives. And joining us today are three people who are absolutely instrumental to the creation of the feature. Joanna Frank is president and CEO of the Center for Active Design and operator of Fitwell in New York City. Whitney Austin Gray is a senior vice president of research for the International Well Building Institute in Washington, D.C. And John Scott is a BOMA fellow and managing director of real estate management services for Colliers in Tampa. Thank you all for joining us today. So let's start with a question for all of you. BOMA International is about to release part 2 of its COVID-19 commercial real estate impact study. Findings so far show that the office remains a powerful tool for tenant success, but we're seeing a paradigm shift when it comes to how the workplace is being transformed. So what will the office landscape look like a year from now? Joanna, let's start with you.
Sure, thank you. And I think, we've all become a little shy about predicting health over the last year and a half. But what I would say is going to be essential, because it's already essential and it will be essential going forward, is that we really need to be able to answer the question, how is your building healthy? And it used to be a nice to have to be able to answer that question, and now it's really essential. So your occupants, your investors, your building owners really need to be able to have that question answered. And so the three things that we already see being necessary and will continue is that you need to understand what are the health priorities of your occupants. You need to be able to respond to how to actually make your building the healthiest it can be using the scientific evidence base, and really being able to talk about the strategies that you're doing and how the evidence base is supporting that, not just looking at viral transmission and COVID, but also thinking about mental health and creating somewhere that people can really thrive. So thinking about green spaces as well as outdoor spaces, as well as maintenance, all of those things that affect all aspects of health, because that's really essential post-COVID. And then the last thing is how are you then measuring the impact that you are having on the buildings? How can you really talk about that our tenants are more satisfied, our maintenance is, reaching the leadership level that you are all in. So really important to be able to measure the impact as well that you're having on health. So that is going to be essential. You have to be able to answer the question, how are you supporting health? How are you promoting health going forward?
I think the thing that everyone in the world wants right now, that everyone wants truly is well-being, right? We don't want to just be free of disease. We want to thrive. We want to connect. We want to return. The places that we create our fabrics to our society. But I think we need to be very aware that when we look a year from now, is that we have to understand, to Joanna's point, that, I love that quote, that those that look too closely at the crystal ball will eat shattered glass. And I think we've learned that over and over in the last year in predicting the future. But when it comes to public health, we know a couple of things, right? So we know that for people to return, to be connected, to be thriving, to be in these places that they love, is that they need to be psychologically and physically safe. And so I think the really savvy, forward-thinking futurists are going to sit there and say, what do we know about public health? We know we need well-being. How are we going to get it? We're going to create and listen to the employees. They're going to drive the market to say, how do I want to return? And there's going to be a hybrid approach and a lot of opportunities behind that, I think, in real estate for experts to say, okay, let's not assume one size fits all. Let's look at hybrid approaches. And we're seeing some really innovative strategies from those fabulous design partners of ours around hub, spoke, ecosystems, adaptability, hybrid. And there are so many opportunities when you, I think, shed the layer of being only a building expert and move into being a people expert.
Coming from a slightly different viewpoint, and my background in sustainability and resiliency, is there has been a major spike in ownerships asking the question about ESG, environmental, social, and governance structures within their buildings. And what I see that occurring is they're trying to create what's the best environment. To what Whitney just spoke about, the employees want to rejoin the workforce and be a part of different social governance structure, and how that can be portrayed into a quality health environment, and also how that the governance structure can be more flexible for the work from home, as we've all experienced over the past few years. But the value that you have together in an office building or a medical building or any of the other buildings that's going to be generated by the interaction of these individuals has come paramount to most businesses. So building on what Joanna says, the science side of it, and Whitney says the social side of it, we're going to reinvent what the office space looks like so that we can extract as much value out of it.
Health and safety are top concerns for building occupants. What then does that imply about the relationship between occupants and the property teams that control the building?
I think the focus has really gone on to the individuals within our buildings. We're even seeing this kind of from like institutional investors. We just did a global survey of institutional investors, and they were really saying that they now understand that their investment in a portfolio of buildings is really about the individuals that are in those buildings, and they're connected to them in the way that they have really not been thinking about before. And that is because we've all just seen what the individual health of people can do to a real estate portfolio, to the occupancy rates. And where building management really comes into this is that you are at the forefront of that relationship between the individuals in the buildings and the building itself. And understanding that this is about trust. Bringing people back into the building is very much about trust. And a lot of the things that we are doing to make buildings into places where people thrive, you can't actually see them with your own eyes as an individual. So we're, changing filtration rates or increasing the amount of fresh air coming in. We've changed our cleaning protocols, but as an individual, I can't see that, right? I don't know what that looks like. And so that's really important that then as a building management staff, you communicate that both physically by presenting a well-maintained space. We know that like signs of deterioration, even like a dead fir tree outside a building, has a really negative, measurably negative impact on trust between occupants and the building managers. So understanding that they are judging how much they can trust you as a building by looking at that building, how it's presented, and then of course, how you're communicating directly about all of the things that you're doing to improve the environment for people, not just meaning the physical environment, but the whole kind of experience. And so you as a building management staff also need to be really expert in all of those things because you're the ambassadors for your building.
I think that there is an opportunity to build on Joanna's point that you move from being a building expert to being a people expert. And I think you also need to say to your tenants, we're in this together. So I don't think the building industry should take on 100% of responsibility to create physically and psychologically safe buildings to return to. You need HR, right? You need your tenant to step up and look at behavior changes. You need your tenant to create a trusting relationship with their own employees.
The idea of control as a tenant imperative came up frequently in all of our conversations. So let's talk about the sense of control as table stakes for coming back to and remaining in the office.
I think that builds on this sort of employee-driven model that I'm arguing that as part of that, the employee is going to be asking for more and is going to be in a space to demand more. But I want to build on why is it important that people have control, even if it's a perception of control? It's because we have to get really comfortable, and we are not, in that we have all dealt with trauma. That does not need to be something we're scared of. That actually can be something that we embrace. But inside of that, when people are saying, I want to wear a mask, even when the CDC has come forward with vaccination protocols, a mask can help you control what you feel like has been beyond your control before that. We also see flu rates upwards of 95, 98% decrease in this last year, which they're attributing in part to mask wearing. Are we going to see people come back and say, no matter what you tell me, building owner, I don't feel comfortable. I need to control what I can control. Here's my list of things. And that building owner and that employer is going to have to say, I'm going to meet you where you are today. And then 3 months, 6 months, 9 months from now, we will reevaluate. But when people are coming in saying, I need to control the things that I can control in my life, we have to be very compassionate. The people have dealt with trauma in so many different levels, and we are just beginning to see this. And I would further say that COVID is not just an infectious disease, it is a chronic disease. We are seeing that play out. Unfortunately, when you are physically sick, people recognize it. When you are mentally sick, people do not see it the same way. So we are right now training our managers to think about how will you be able to have the emotional intelligence to deal with the requests that are coming in from tenants are not all going to be about temperature. They're not all going to be about ventilation, filtration, and cleaning. They're going to start asking you questions that are really going to be about how they're managing their psychological and physical safety in their return to work.
Most of my focus has been on the EQ, not the IQ side of this. The emotional quotient that she's discussing is you have to meet each individual person where they are emotionally at that time and be able to understand that. So that's what I've talked about my managers through this entire pandemic, is the fact that, it's really about the psychological state that you're dealing with, not what they know, because everyone can read the CDC guidelines and all that. What does it mean to them? It means something different to everyone. So each person, due to their economic, their social, and their structure that they're in now, are looking for different things, whether they feel that they can be focused on their desk being cleaned repeatedly, and that makes them psychologically feel better. And a lot of them do have children ask for extra cleaning that's going forward. So you're dealing with the EQ on that side of it. And regardless of whether that cleaning actually makes a difference for the spread of this in this pandemic, it's really not the point. It's a psychological comfort. So I agree with Whitney and with Joanna on that 100%. Where will we be when the CDC releases new guidelines? Will we continue to do more cleaning for those even when it's not required? I'm not certain at this period of time, but I would say yes, because you're trying to create that trust. And going back to what we were talking about, the productivity of the person, isn't that the measurement that we're really looking for? If they're being productive in their office, that means there's trust, which Whitney brought up and Joanna is talking about here. So I think there's going to be a numerous amount of changes, and they're going to be adjusted for each different group and each different person. And I do believe it's an employee market at this period of time, and probably will be for a long time.
Right.
So I'd love to build on that, what
Please.
both John and Whitney were saying. I think as an employer, I think there's a real understanding now that your productivity as a company is directly correlated with, how satisfied your employees are and how they are feeling, and if they are feeling, supported by you. And we already knew even before the pandemic that depressive symptoms accounted for the most time off and sick leave globally. So the most amount of absenteeism was being caused by depression. And that's according to the World Health Organization, right? This is a global statistic, the depressive symptoms. And so that was already a very much a top of mind for employers, understanding that their psychological, their mental health of their employees has a very direct correlation with productivity. And this has been an incredibly traumatic experience, as Whitney was just talking about, and it has increased levels of stress, increased levels of anxiety, as well as increased levels of depression for everybody. So us as humans and people, not just as employees. So really understanding, but I think what's empowering about being a building professional is that you can have a measurable impact on people's stress levels and anxiety, because there's a lot of things about our physical environment that actually impact our mental health, including being able to see daylight out of windows, having access to really well maintained greenery, either inside a building or outside the building itself. And there's actually air quality doesn't just impact physical health, it actually impacts your mental health as well. And it's actually an equity issue as well. So it ticks many boxes. So understanding that we as building professionals have a direct impact on the mental health of the occupants of the building, I think is empowering, because the evidence base already exists. We don't have to go out there and think like, oh, how is it that I'm affecting health with my building? Public health research has already made that connection. The research exists. It's just a case of empowering folks across the real estate industry with that knowledge. So I think that I would say that's a positive, and that we are part of the solution. And that to me is rewarding, and we want to be part of the solution, and we can be part of the solution. So for me, it's a positive that we are in this, right, with both feet as building professionals.
Ownerships used to look at risk profiles or the liabilities of the different buildings, and that's how they would make judgments going in the future. And to Joanna's points you just made was the fact that the health profile of it was not a major risk to the buildings. And this has obviously brought this front and center to ownerships and development and for the funds that are looking into this. And that's why ESG and healthy buildings are now, they're going skyrocketing. And I would just create the analogy, as you know, I've been in energy reduction and sustainability and resiliency for 30 years, but it wasn't until climate change started occurring that you started seeing a lot more deployment. And that just tends to be how the cycle occurs. So I agree with Joanna and Whitney, now's the time for you to make the move in the healthy buildings. And I'm seeing all those requests. And it's a driver, it's a market driver. And just like saving energy was a case study for me and telling them why they should do it from an economic side, now we're talking about it from a productivity side. And I think that's where this should be. And I think it'll be very successful. And in our field, if the ownerships are saying we need that, then it makes my job much easier to deploy and train and do all of those things. So I think it's a part of the whole coming together.
What are your views on the increasing interplay between wellness and sustainability? What's the trend we're looking at here?
We are seeing demand for healthy buildings coming from the individuals in those buildings, whether it's residential or commercial properties. Individuals are demanding health, but investors are demanding health as well. They are demanding those ESG metrics, which cover environmental, social, and governance. And I can make a pretty good argument that each one of those is a health metric, or there are health metrics within each one of those categories. But obviously, it's easy to talk about the S in ESG when it comes to health. But we can really, why sustainability if it isn't about human health? So ESG is really driving this. Talk about a big dollar figure, 40 trillion. How about that for a large number? That's the amount of money that's in ESG at the moment. And that is looking for a home, right? Investors are looking for companies to invest in who are meeting the metrics, who have metrics around ESG performance. So you have this moment that's happening. Individuals are demanding health. Global investors are demanding health. And as building professionals in the middle, we are a great home for that investment because we really do impact health. And we have already been measuring sustainability for a long time. We just did a survey of global investors with the UN, and 92% of them said that they're going to increase their focus on health and wellness over the next 3 years. So if they are increasing their focus, we all in the building industry and companies at large are going to be really focusing on this because that is obviously a key driver of decision making. We need those investors.
I really want to thank all three of you for your input and your time. It was a real pleasure. Thank you very much.
Thank you.
Thank you.
Be well.